Other developing story, millions of people in China are heading back to work after the Lunar New Year break was extended as part of the effort to contain the new coronavirus outbreak. Nevertheless, there has been a record increase in deaths from the virus for a second day running. Official figures show that 97 people died from the virus on Sunday. That's the highest number of casualties in a single day. The total number of deaths in China is now 908, 910 worldwide. Across China, around 40,000 people are infected, with around 187,000 under medical observation. Robin Brandt has the latest from Shanghai.
Well, here in Shanghai, the commercial capital, usually home to 24 million people, it was supposed to be the first day back. But I have to say, it was a trickle. The banks remain closed. Most of the shops remain closed. There's a small number of people out there. But there are clearly a lot of anxieties amongst people living here in Shanghai. And the numbers of those coming back is almost certainly going to be staggered as well.
Well, governments around the world are ramping up efforts to stop the virus spreading. Here in the UK, 8 people have tested positive for the virus. The government declaring coronavirus a serious threat to public health. Let's get more on that from our health reporter, Michelle Roberts. What is the government saying here?
So the threat to the general public remains moderate. That's not changed. What's happened today is that they've put in place some extra measures that mean legally they can hold people in quarantine. So anybody who was thinking about leaving wouldn't be able to. So that's the heightened...
It seems significant, though, in itself. And they're worried, aren't they, about the extent at which it's spreading. We've also heard this phrase, super spreaders. What's that?
I mean, the talk now is all about containment, obviously, to stop it spreading to other people. We've heard about 4 more new cases today in the UK. They were linked to a man who'd been to a conference in Singapore, then gone on to France to a ski resort. Those 4 people are linked to him in that ski resort. So it appears that some people might be able to pass the virus more readily than others. We don't know why. So experts so far had thought possibly somebody who's infected might pass it to 2 or 3 other people. In this most recent example, it seems to be more than that, so hence the term super spreader. But it's not down to the individual, it's just how the virus behaves in different people. So it's very much we're learning how this virus is different for different people.
And could it be that people can spread the virus before they're even symptomatic, so they don't know that they should be isolating themselves?
Exactly. I mean, at the moment, the advice is to isolate for 14 days if you think you might have been in contact with the virus. Some people will get symptoms, so they might get fever or a cough, but other people might not recognise the symptoms. It might be very mild or no symptoms at all, so it is tricky to try and contain it entirely.
And difficult in terms of messaging for the government, isn't it? Any government, to say this is serious and imminent, but don't panic.
Yeah, and it's definitely not a case of panic. We're not seeing any onward transmission in the UK. We don't see it circulating yet, but that doesn't mean we should be complacent either. And obviously containing it at source is still the priority at the moment.
Michelle, thanks very much for getting us up to date there. In China, millions of people are heading back to work after the Lunar New Year break was extended as part of the effort to contain the new coronavirus outbreak. Nevertheless, there's been a record increase in deaths from the virus for a second day running. Official figures show that 97 people died on Sunday from the virus. That is the highest number of casualties in a single day. The total number of deaths in China is now 908. It's 910 worldwide. Across China, around 40,000 people are infected and around 187,000 under medical observation. Our correspondent Robin Brandt reports.
Well, here in Shanghai, the commercial capital, usually home to 24 million people, it was supposed to be the first day back. But I have to say, it was a trickle. The banks remain closed. Most of the shops remain closed. There's a small number of people out there. But there are clearly a lot of anxieties amongst people living here in Shanghai. And the numbers of those coming back is almost certainly going to be staggered as well. So, I mean, the centre of the city is service sector heavy. So so there has been a lot of working from home directives that have gone out from the companies, both private and public. On the outskirts of the city, it's more production heavy, in particular in the automobile industry. We understand that VW and its Chinese partner, they intended to get back to work today. But on the whole, it's been a trickle. And we have also seen at the same time tougher restrictions come into place in terms of getting into compounds, lanes where people live, and also buildings. We're seeing temperature checks. They're very frequent, a need to produce identification as well. There are restrictions on people who don't live in places going into those places. So it's a problem to have guests as well. So on the whole, the first day back is pretty much a trickle. And clearly it's going to be staggered over a longer period of time, because when it comes to these massive cities like Shanghai, what the authorities are really, really worried about is that return exodus of millions and millions of people after this extended Lunar New Year break and the potential that brings for more spread.
Scientists working with the World Health Organization say their initial analysis of this outbreak suggests that it kills around 1% of those infected. The British scientist Neil Ferguson, who led that research, says it's a figure that would make the epidemic comparable to the major influenza pandemics of the 20th century.
OK, Neil Shearing is chief economist at Capital Economics and a familiar face. Neil, good to see you. Well, let's start with this. I guess we can't underestimate the millions of companies on this planet that rely on this country, and in particular that part of the region, right? You know, the Wuhan region, for their goods. If they're not making, we're going to start seeing problems soon, aren't we?
I think we are. I think the tendency when you get hit by an epidemic like this, you try to reach for historic parallels. And of course, everyone reaches for SARS, right, which hit the Chinese economy quite hard, then rebounded. But of course, that was in 2003. China was a lot smaller economy. It's the second largest economy in the world now. It's this manufacturing hub in the centre of China with spokes reaching out to the rest of the region, but also the rest of the world. And of course, the world's changed in terms of the way that firms manufacture their products. They run a much tighter ship, inventory levels, stocks.
It's more efficient, is that right? I mean,
much more efficient. They're not sitting on warehouses of component parts that they can just plug into the supply chain. They're transporting this stuff from China and
just
others.
In time, is that right? Just in time
exactly.
Goods, right.
So that means that there's both the mechanism, the transmission mechanism for this disruption to spread from China to the rest of the world, but also that it can spread much more quickly. Previously, perhaps if you go back 10, 20, 30 years, you might have been able to sustain this for, say, 3-4 weeks. Now it's going to hit in a matter of weeks.
Wow. And when we say hit, meaning certain products won't be available because they won't be able to manufacture them. Can I just say this? Fiat Chrysler, for example, today warned that it may have to shut its European manufacturing down because it can't get the parts from China into Europe to make the cars.
And it's the car sector, it's the textile sector, it's the electronic sector. These are the companies that really run lean ships that don't have much of this stock that are going to be hit first, I think.
And the other side to all of this is for the companies outside of China who sell their goods in China and rely on big consumers in that country. Chinese people aren't consuming at the moment. They're locked up in the homes.
No, and this takes on several forms, of course. There's just buying stuff. Chinese people buying stuff from other countries, but also China as a market for tourism has grown hugely over the past few years.
You mean the Chinese tourists going out?
Chinese going out to the rest of Asia,
biggest tourists in the world,
particularly at this time of year as well. So, and that's going to hit countries in the rest of Asia particularly hard.
Yeah, I know. South Korea is a popular country, Japan, Thailand, and that's money. I've said this before on the show to other experts, but in terms of the travel and the tourism, that's money that those countries can't recoup.
Yeah, exactly. So if you don't go on a holiday now in China, then you're not going on holiday all year.
Yeah. And just briefly to end, I know it's still too early to put numbers on this, but some experts I've spoken to say if this goes on for, I don't know, a couple more months, I mean, China's economy could get hit by 2 to 3%. A loss of that is going to affect our global growth numbers.
That sounds plausible to me. About 2 to 3% percentage points hit in terms of Chinese growth. So that is going to directly knock about 0.4 percentage points off of global growth. Bear this stat in mind. For the last 43 consecutive quarters, the global economy has grown. I think we could break that streak in the first quarter of this year.
Wow. OK, we're going to keep our eyes on that. But we appreciate your time as always, Neil. We'll talk to you again, no doubt, very soon. You stay there. I'll do all the running around.
Welcome back to Impact on BBC World News, and we're going to take you live now to Geneva, where the World Health Organization is having its daily news conference about the coronavirus.
Many of those countries have already started using them. Another shipment of 150,000 tests is being assembled in Berlin today and is destined for more than 80 labs in all regions globally. Last week, the African CDC conducted training in Senegal with 12 countries using tests sent by WHO, and further training will take place in South Africa next week. WHO will continue working with all countries to prevent and detect rapidly new cases of coronavirus and to save lives. I thank you.
Thank you very much, Dr. Tedros. So we will start immediately with questions. As always, we will start here in a room, and then we will go to our colleagues online. Please, one question per journalist so we can try to take as many as possible. To Mark and Gabriela, please.
Yes, I have a question.
If you can just take a microphone. Sorry, just here. We have a rowing mic for today. Thank you.
Hi, this is Liu from China's Xinhua News Agency. Two questions. Sorry. One question. Okay. Does WHO has any comments on the reports, the latest reports that there is a breakthrough in research about the virus? That researchers in South Australia, the New South Wales, I guess, they have successfully managed to obtain live virus from the patients instead of synthesize the samples. Does that help in any way to quickly detect the virus and diagnosis, judging from the WHO's point of view? Thank you.
They have synthesized the virus? I didn't understand. Question. Can you repeat just the question, please?
Yes, the latest reports from the Australian health authorities from New South Wales. The researchers have successfully managed to obtain a live coronavirus from infected patients instead of synthesize the samples from laboratory. Does WHO know that or had any comments on that?
Okay.
I think a number of labs have isolated the virus now around the world, so I think, and are actively sharing the virus as well. So it's really important that we have multiple isolations. The sequencing of the virus is very important. It allows us to track the sequence, but being able to isolate the virus itself provides the basis for both therapeutic and vaccine development, as well as the development of diagnostic assays, particularly serology, which we need right now. And having live virus is very important for developing the neutralizing tests and other things we need to test for the presence of the antibodies to the virus, which will allow us to look at population attack rates, not just look at who's been infected and who's been sick, but to potentially look at a broader proportion of the population to see if there are milder cases out there that we're not detecting. So live isolation of the virus allows a huge advance in diagnostics and potential advances in therapeutics and vaccine development. But the virus has been isolated for a good while now, and many labs have done that.
The viral culture of the virus in laboratories is indeed a next step, I mean, to the normal diagnostic, which is based on PCR. And it's indeed very important, because when you have, for example, the genetic sequence, is like having the ID card of the virus, but not the virus itself. So here, with having the virus in hand, it's indeed much better to make testing and to make probes against therapeutics or vaccines.
And just to get you up to date on what the WHO chief began with in his briefing, he said there are now 909 deaths in China, 40,235 confirmed cases. 99% of the cases of this coronavirus outbreak are in China and are mild, he says, the vast majority of them. 319 cases outside China in 24 countries. 1 death reported outside China. A team of experts from the WHO has now arrived in China. We'll keep you up to date as we get more significant news on the coronavirus.
So, as promised, let's return very much to our main story, the spread of the deadly new coronavirus. The World Health Organization has said in the last hour or so it is concerned about the spread of the virus among people who have no history of travel to China. Well, let's talk about the various lines of developments. I'm joined by Lauren Sauer, an assistant professor of emergency medicine at Johns Hopkins University School of Medicine, where she studies disaster response and robustness. And here in the studio by Dr. Natalie McDermott, a clinical lecturer in infectious diseases at King's College London. Thanks both of you for being here on the programme. Natalie, let me turn to you first of all. That warning we've just heard about the spread outside of China, just described as the spark that could lead to a much bigger fire. Is the WHO right to be that concerned, do you think?
Yes, I think the WHO is right to be that concerned. We've seen that cases, or at least the number of daily new cases, has sort of plateaued and started to decrease in China. But we've started to see an increase in a number of cases in other cities that were affected with just a handful of cases previously. And particularly Singapore is a concern because there seem to be new cases being identified in Singapore, but who we don't know who they had contact with to get infected.
I'll come back to that point in a moment, but let me bring Lauren in because WHO were also saying that they are sending a team to China. They're also sending kits to various countries in Africa, countries like DRC, Cameroon, Gabon. I mean, does that make sense in terms of the right approach, do you think?
I think absolutely. One of the things we worry about seeing that decrease in the number of case counts right now, where we're still actively finding cases, is that it's just because of a lack of capacity to test rather than cases actually dropping off. And so not seeing any in Africa, for example, might simply be that they don't have the capacity to identify and test these patients. So sending tests and supporting the region is absolutely important.
There's been a lot of concern in the UK and other countries about so-called super spreaders, people who've infected multiple people in multiple countries. How difficult is that to actually stop?
It can be a challenge. Identifying these people's contacts is really important. And in cases like this, respiratory viruses, it's even harder to identify contacts than in situations like with Ebola.
Natalie, in terms of what you were saying about unknowns, part of the big unknown here is just how many people left Wuhan who potentially were infected, where they went, who they came into contact with. We still don't know the exact numbers or anywhere near the exact numbers, do we?
Yes, I think that's true. And we can be fairly certain that the numbers that are being reported in China are probably much lower than actually the amount of infection, purely because what's being reported is the number of people who feel unwell enough to go to hospital and are tested. There'll be a large proportion of people who maybe only have a mild infection, don't seek medical care and so aren't tested. And we don't know how long those people can be infectious for. So it's just a matter of identifying people where we can through contact tracing and then trying to isolate them. But when we're missing a chunk of those people, that's very difficult.
And you touch on one of the worries, which is the numbers, the official figures, and perhaps if that is different in terms of what exactly is happening on the ground, that is still to become sort of followed and pursued. What do we not know about this virus that would actually help us, do you think?
So I think we're trying to learn a little bit more about how infectious it is in the period between someone being infected with the virus but before they develop symptoms yet. How long people can be infectious for after they've had the virus. So if they just have a mild infection, at what point does that stop being a problem and they're no longer infectious to others? And then also, are there people who could never have any symptoms but be carrying the virus and be infectious to others? And if we can understand those three parameters, it guides us a lot in the measures we take to try and contain it.
Lauren, let me bring you back in because part of the problem here is actually people actually knowing what the symptoms are and then what to do if they have those symptoms.
Yeah, one of the biggest challenges about this outbreak is that it's happening during influenza season, where influenza and other respiratory virus season, where people are sick with the flu or sick with RSV, sick with other common colds that happen this time of year. And so differentiating people who may have illness, whether it's severe or mild, purely by their travel history will start to be even harder as we see these outbreaks go beyond just Wuhan.
And Lauren, in China we've had the various lockdowns, where in the UK we're just bringing in or looking to bring in regulations after reports that perhaps somebody in quarantine was about to abscond. Is forcing people to do what is needed, I mean, that is not a given, is it?
No, I think it's important to note that there is very limited evidence to support travel bans of this magnitude. In fact, we just released a paper on this. There is not enough evidence to say that this is the appropriate approach. And we always need to think about how we're being the least restrictive possible while still trying to support public health measures. People will move if people want to move. And if you implement these wide-reaching travel bans, oftentimes people try to hide their movements, which just makes it harder to do that contact tracing that we were talking about earlier.
Natalie, final 20 seconds. I mean, what are you keeping an eye on in terms of how you see this going? What is important? What are the critical next couple of things, do you think?
I think watching how things develop in Singapore in particular, but also within the UK here. We don't anticipate any more cases, but there is a possibility of that. And just seeing what develops over the next week or two in terms of case numbers.
Well, Natalie McDermott and Lauren Saw, thanks very much for being here on the programme and discussing the latest implications from the news that is emerging from that WHO press conference. Now, still to come on today's programme. Now, as promised, let's return to our top story, the spread of the deadly new coronavirus. The World Health Organization has said it's concerned about the spread of the virus amongst people who have no history of travel to China, saying it could be the spark that becomes a bigger fire. Well, let's talk to Laurie Garrett, who's a former senior fellow for global health at the Council on Foreign Relations and a Pulitzer Prize-winning science writer. Thank you so much for being here on the programme. Do you think the World Health Organization are right to be so concerned about those people who have never travelled to China but still have become infected with this virus?
I think it's overdue to have that concern, and that everywhere in the world governments should be thinking, are we ready? Doesn't mean paranoia, it doesn't mean panic, but this is your window of opportunity to look at your system carefully, look at your hospitals and decide what steps can we take right now to better save and spare our people if this comes to our shores.
And what do you mean by are we ready? What are the sorts of things that should be in place now, do you think?
Very few physicians working today in most of the world have actually been in an epidemic, have actually dealt with something so contagious, spreading and causing panic, causing fear, and been able to keep a cool head and know the sort of chain of command within their hospital, the chain of command in their health system, so that they know exactly who they answer to and what they should be doing. We just haven't faced this before. And many governments are basically untested. And then you add to it that we're already out of our global supply of surgical masks. We're running low on everything already. Why? Because most of it's manufactured in China. And as China is increasingly cut off from the rest of the world, so is the supply chain for essential, not just goods that we need to tackle the epidemic, but all medical goods, including such things as antibiotics and insulin.
You talked about the speed of the spread. Should we be alarmed at the speed of the spread that is outstripping SARS, or reassured that it is not as deadly?
We don't know how deadly it is. We know what the Chinese official numbers tell us. But as we see outbreaks...
Are you sceptical? Are you not taking that at face value?
Well, one Chinese city reports a 4.8% death rate, another a 1%, another a 2%. We're going to probably really figure it out when we see how it plays out in places like Singapore, Japan, other countries that are starting to see the beginnings of little localized outbreaks.
And as you say that, I've just been looking at the latest information from Hong Kong. They're evacuating residents from 2 blocks of a building there with their latest fears and worries and outbreaks. You won a Pulitzer Prize for your coverage and writing around the Ebola outbreak. Is there anything we can learn from that that's relevant to this?
Not so much. I would concentrate on what I learned by being in China and Hong Kong throughout the SARS epidemic in 2003, and then going back to see how countries had changed their response capacity that had suffered, such as Vietnam, Thailand, Hong Kong, mainland China. And I think from that we can learn a great deal, because most of the worst outbreaks were focused on hospital facilities where there wasn't a sufficient level of readiness or training. So it's one thing to have gloves and masks and to cover your face, but you have to really get trained in how to put everything on properly, and most crucial, remove it without infecting yourself in the process of removing a mask. Removing, you know, if the gloves are contaminated on the outside, do you know how to take those gloves off without getting this hand contaminated? And then maybe you touch your nose or you put food in your mouth. Everything has to be washed, everything. And this takes training. This is the kind of training every single hospital in the world should be doing right now.
It's really interesting you say that, given that just in the last hour here in the UK, 2 of the 4 new cases we've had are from health workers in our healthcare system, so exactly relevant to what you've just been describing. Laurie Garrett, thank you so much for joining us live there from New York. Thank you.
My pleasure.
Now, still to come on today's Global Business. Well, as car makers start shutting down factories outside China, we assess the impact of the coronavirus on the global business community.
My name is Tarek Al Hussein. I'm a photographer. I live in the city of Abu Dhabi, and I've remained in Abu Dhabi for the last 7 years because I've really enjoyed exploring the landscape. There are 215 islands, and you have a great diversity of different environments. As a photographer, it's been a great learning experience, and up till now, a very wonderful journey.
Hello, this is Global Business with me, Matthew Amreliwala. Nissan halts production at its Japanese plant as the outbreak of coronavirus means it can't get the parts it needs from China. And President Trump unveils a controversial budget with a rise in defence spending and big cuts to social services. Hello and welcome to Global Business. Let us start with the impact of the coronavirus on the business community, because earlier today Nissan became the second global car maker to announce it's been forced to shut a factory outside of China. That's because the Japanese car maker can't get the parts it needs from China to keep making cars. Now, Hyundai announced last week it was halting production in South Korea in another clear sign of the ongoing impact of the virus on the global supply chain. Well, our business correspondent Theo Leggett joins me here in the studio. And Theo, how severe is this disruption to the whole supply chain for the car industry?
So far, it's not as severe as it could be, and most car makers are playing this with a watching brief. There is potential for a great deal of disruption. As you say, Hyundai have already had to suspend production in South Korea. Renault, incidentally, has as well at one of its plants. And then today we've got Nissan having disruption at its plant in Japan. So all of this shows there is a vulnerability. The problem is that the car industry is particularly vulnerable because car makers tend to operate just-in-time delivery chains. So their supply chains mean that if a car is being assembled in one place, all the parts from that car have to come from all the different parts of the world where they're made in time to be fitted on that car when they're needed. There is no warehousing, and that is the problem. If the supply chain is disrupted and even a few parts are not appearing when they should, the whole of the production line can slow down.
Now, I know you've been talking to a whole variety of car makers. What have they actually been saying to you?
Well, most of them have had to suspend production in some way, shape or form in China. A few have been trying to get that back up and running today or this week. A lot of them are waiting into next week. But that is localised production for the Chinese market. The potential problem becomes if supplies of parts to the rest of the world falter. Now, there was a suspension of production anyway for the Chinese New Year, which means that more parts were being shipped than would be normal, and so at the moment, that isn't an issue. But if the plants in China that are supposed to be coming back online this week and next week don't come back online, the factories that are producing parts, if the crisis gets worse and we see the supply being interrupted for longer, then plants all around the world could be particularly vulnerable, especially in the United States. They source a lot of their parts from Chinese factories.
Just a final thought then, which other sectors are seeing an impact? And I suppose yet we're still in a holding pattern on predictions because we simply do not know how long this is going to last.
We don't know how the situation is going to develop. As you say, some factories are starting work again this week after the extended Lunar New Year holiday. But if others don't open up or if they remain shut down, there is a problem. The most exposed sectors, apart from the auto industry, are technology and electronics. A lot of parts for those industries are made in China and then shipped out. So we've heard, for example, that there could potentially be delays in sales of new iPhones as a result of all of this.
All right, Theo Leggett, thanks for taking us through all of that. Thank you.
Let's turn to coronavirus. There are 4 newly confirmed cases of coronavirus in the UK, and 2 of them are healthcare workers. 2 health centres, one in Brighton, one in Northamptonshire, have closed as a precaution. The 4 people infected were all in contact in recent weeks with a businessman who contracted the virus at a conference in Singapore and was diagnosed in Brighton last week.
So is coronavirus spreading more widely and can it be effectively contained? We've gone back in time to Monday the 20th of January when the WHO first began tracking and publishing a tally of those infected. Here are the same stats 1 week later. By the 3rd of February, there had been, you can see here, quite a jump. But it's today's figures that show a really significant increase. There are more than 40,000 people infected, 910 people have died, and 97 of those deaths have come in the last 24 hours.
We can speak to Lauren Sawyer. She's an assistant professor of emergency medicine at Johns Hopkins. She's an expert on preparing for critical events. And with me here in the studio, Peter Oppenshaw, an immunologist and expert on experimental medicine at Imperial College London. Welcome to you both. Lauren, can I just start with you first of all? We've got 8 cases now confirmed in the UK. The government today deemed the virus a serious and imminent threat. Is it now spreading?
Yes, I think we knew it was going to be spreading. We've been gearing up for these potential spreading events, or super spreading events as some people are calling them. And anytime you see healthcare workers getting infected, you can be assured that you will see more spread.
Peter, let me bring you in. Let's just talk about this businessman. I'm intrigued by this businessman. So he comes back from a conference in Singapore and he goes to a chalet in Chamonix, and all told, he has infected 11 people, and they're calling him a super spreader. Now, with normal flu, if you had a cold, you would perhaps infect 1 or 2 people. So does this mean that this virus spreads more easily? Or is there a moment where he's in contact with a lot of people where he is virulent? He's just going to spread it to everybody he comes in contact with. What do we know?
It's a controversial term, the super spreading term. I mean, this was coined particularly in relation to the SARS outbreak in individuals who were infecting a large number of people, often because they were in accident and emergency departments and maybe needed intubation or some event that meant that they were exposing a lot of people to their respiratory secretions. Now, it looks like this particular individual seems to have been able to get around and behave relatively normally, maybe even go skiing, but yet has been able to infect a large number of people. It's all a matter of how much virus is being produced and how easily it's contaminating other people. There are so many things we don't know about how this virus spreads and why it is that some people who seem relatively unaffected personally, but seem to be producing virus that goes on to infect other people.
Lauren, you deal with emergency responses to this kind of thing. First of all, let me just clarify about the masks. What do we know about the masks? How effective are they?
Yeah, we know a lot about masks, actually, but one of the things that we've been seeing in this outbreak is people wearing masks who are otherwise well. And both the WHO and the CDC do not recommend using masks as a well person to protect yourself from the virus. the masks generally, when you see them in the healthcare environment, for example, during flu season, it is for patients with flu or respiratory viruses to put on to protect their secretions from potentially infecting other people. Healthcare workers wear masks because of their prolonged and intense exposure to patients who are sick. Masks in well people is not recommended. It is not evidence-based. We don't have science that supports their use, and may potentially do harm in people who are having respiratory responses and may impede breathing.
And how? My second question is, how smart is it to be incubating people, isolating people on these cruise ships?
Yeah, the cruise ships are a really challenging question. Obviously, cruise ships spread virus pretty easily. We see that in the regular norovirus outbreaks on cruise ships. From what I understand, these people are isolated in their individual rooms. The sick people are separate from the well people, so the well people are being quarantined in separate areas and are kept separate as best as I can understand. I think ideally you want to get everyone off of the cruise ship and into care or into home quarantine as quickly as possible, while we understand how the infection has spread.
The weird thing, Peter, is that there is a woman who's been taken to a Japanese hospital and she's got coronavirus, but she's not showing many symptoms. She's got a cough. Her husband, who she shared a cabin on this cruise ship with, slept in the same bed. He's not showing any symptoms. He hasn't got it at all.
No, there's so much we don't know about how this virus is spreading, what it is that makes one person susceptible and another not. It may be that actually all of us can carry genetic variations in our immune system which defend us against viruses in different ways, and we just are learning so much. The opportunity for doing some really important research, not only in countries and in cities where there are a lot of cases, but also, for example, in cruise ships, so that we can really understand this well, is extraordinary. And the rate at which China is coming out with wonderful research findings, which really help us to understand the virus, is remarkable. We've never seen anything like this before.
Peter, can you clarify, is it the speed at which this virus is spreading or the lethality of the virus itself once people have it that concerns you the most?
Well, so the impact of any pathogen is a sort of product of multiplying the speed at which it spreads by the danger that it creates for the individual. In this case, it's spreading much faster than the SARS virus, another coronavirus in 2002-2003. It was possible to defeat that with public health measures, but it was a very severe pathogen, killing about 10% of all those infected. This seems to actually be much less lethal, but a much better spreader. And the result of the high number of people plus the appreciable lethality is the thing that we're most concerned about.
Lauren, just a quick final one for you. I mean, we've been covering this for weeks now, and when you look at the death rate, it's estimated 1% of those infected die. I mean, that is on a par with seasonal flu. Are we blowing this out of all proportion?
Well, I think the important thing to note is the case fatality rates, the death rates estimates are just that, they're estimates. We don't know a lot about this virus. We don't know a lot about the more mild cases and the asymptomatic cases. So likely and hopefully we will see that death rate actually drop. We often tend to compare risk of well-known things like flu with unknown things like this coronavirus because it helps us sort of put that risk into context. And that can be troublesome because there are things about flu that are very different. We have good diagnostics, we have good therapeutics, we have vaccines to varying degrees of success, and we know how to manage flu cases. We practice for it every year. Even pandemic flu cases, we can learn a lot from our seasonal flu management. In this case, with all these unknowns, it's a different management approach and it's a different threat. And I think that's what's driving the more extreme measures of precaution that are happening now.
Just very quickly, Peter, you want to come back on that?
I absolutely agree. I mean, this is what's frightening about this is the unknowns, and also it's a very protracted disease, and sometimes the deaths are occurring at week 3 or 4 even. The lethality of influenza tends to be more like 1 in 1,000 or less. And here, a mortality of 1 in 100 is really very high.
Fascinating. Thank you both for your thoughts, Peter Openshaw and Lauren Sire. Well, in China, counting the cost of
Good
disease.
to clarify all of that.
Very important to clarify all that, because a lot of those questions come up on social media for us all the time. So good to get some expert analysis on that. We're talking about it in China, though, where the disease goes far and wide. Xi Jinping said his government will work to prevent large-scale layoffs. Many in China were due to return to work today after the Lunar New Year holiday, but much of the country remains closed to contain the virus's spread.
The economic cost has mounted as shutdowns in the country continue to disrupt global supply chains as well. Our economics editor Faisal Islam has this report.
It should be back to work in China. After celebrating Chinese New Year, tens of millions of workers were expecting to have returned to the cities and to the factories, one of the fundamental drivers of the world economy. But the commute is so far quieter than usual, and in the offices that are reopening, it's anything but normal.
Our company has adopted some special measures, including sanitising every day. The building is in isolation. We are required to wear masks the whole day while at work.
In the shops, food prices have surged, up 20% on last January. Pork prices have more than doubled. At the same time, the economy is slowing. The actual economic impact will depend, of course, on the global health impact. But what we do know is the virus and measures to contain it have led to many factories remaining closed today that should have reopened by now, slowing Chinese demand for luxury goods and crude oil, as well as reduced Chinese tourism abroad. And some supply chains for key parts manufactured in China are broken, with many global businesses seeking alternatives, for example, in Vietnam. The already weak Chinese economy is expected to see the slowest 3 months in over a decade, possibly a contraction, and in turn that could see the same for the entire world economy, an immediate global hit worth over £200 billion. The expectation that this will be made up over the rest of the year when or if things get back to normal. And that can be seen even 5,000 miles away in this Yorkshire electronics factory, dependent on components shipped in from shuttered plants near the centre of the outbreak.
We have been able to find alternative sources for the materials, but because we need them quickly now, then there are price implications, and some of that has been as much as 3 times the original cost.
There has been major disruption likely to delay recovery in an already fragile world economy. President Xi Jinping, appearing in Beijing in a protective mask, says if the virus is contained, the impact should be temporary, but that isn't certain right now. Faisal Islam, BBC News.